It is the time you have all been waiting for, the event of the year. I just want to welcome everybody here and online. I understand the numbers are off the charts, so we've already topped 100 and people keep joining on. This is better than American Idol. All right? And yes, you folks online, wherever you are, get on your wireless, get ready to vote, because you get to only vote once, here at Hopkins once. You will be part of this exciting opportunity to really help further the culture that we have here, the spirit, the ethic that advocacy matters. And I want to really thank our finalists who are here to do our pitch so that we can further help you be really effective in making a difference out in the world with your research, your findings, and plug into making our world a little healthier, a little more equitable, a little safer out there. So I'm Shelley Hearn. I think officially I have the longest title at Johns Hopkins. I don't know I have enough fingers, but I am the Deans Sommer and Klag Distinguished Professor of the Practice of Public Health Advocacy. Got it. And even better, I'm the director of the Lerner Center for Public Health Advocacy, which is sponsoring this prize. And yes, it does deserve a whoo-hoo! Crowd be wild. I can hear you online. Quiet. The center is now the Lerner Center because Hopkins has been for years. It's one of the almost the best kept secret out there. Its deans, past ones, Sommer, Klag, Ellen McKenzie, have been wonderful champions for public health. They've been great role models for taking evidence and making a difference out in the world. But advocacy has not always been a comfortable space in many places, many schools, many programs, many governmental offices. And it's become very clear, certainly through the pandemic, but even today as we face some of the greatest health challenges, that we can't just write reports, we can't just do journal articles. We have to make sure our evidence is making a difference. And so the Lerner Center is here at Hopkins to not just help our community, but to bring visibility to what we've done for decades and export those skills, knowledge, and ethic of how to effectively take evidence-based information and drive policy change. We're hoping as a center that we create not just foster the community here, but we help have a diverse, robust advocacy culture in our entire field of public health. That's what the center does through its education, through its writings, through its teaching, through its service, and the awards here. Now, this award, we really have to thank to the spirit and commitment from Sid and Elaine Lerner. So I've noted that we have a history of advocacy here, but we haven't always heralded it. We haven't stood on the mountaintops and been the example to the public, to the public health field that advocacy matters. And that's the difference that Sid and Helene Lerner made for here and for our field. That putting their time, energy, and saying advocacy matters, that's what this prize and the other innovation prizes that we've had with their names on it is really to help boost and get the attention that advocacy deserves. So thank you, finalists, for being here as part of that. Thank you to the learners for making it public. And now, thank you to our dean, Ellen McKenzie, who's going to drop in and give us a few words of inspiration.
Hello, everyone. I sure wish I could be there with you in person for this exciting event. Thank you for being present and for supporting the impressive advocacy work happening in our community. I'd like to congratulate the finalists for the Sommer Klag Advocacy Impact Awards and wish you all the luck. We're so grateful for the work you do. Thanks to you, the future of public health advocacy has never looked brighter. Our entire community has an important role to play in making social, cultural, and policy change possible, and this is just one step we can take to enhance our own culture of advocacy. I encourage you all to participate in efforts to lift up advocacy as an essential pillar of public health, whether that means incorporating advocacy in your teaching or translating knowledge to policymakers. Our actions can inspire all schools and programs of public health to be part of the change. I hope you'll find the pitch presentations engaging and inspiring, and that you'll join the Lerner Center to celebrate the winners at a reception afterwards. Again, congratulations to the finalists and best of luck.
All right, so I'm going to introduce the judges. We've got 3 extraordinary judges. Do I have a drum roll? Oh, yes, people, thank you, thank you. We are going to start right going from my right to my left, though I actually sometimes don't know left from right, but that's okay. Lamari Morales, you all know her. She has an official title, Associate Dean for Communications and Marketing. I truly do think of you as the czarina of all public health communications. And the reason, if I were president, this isn't a running announcement, if I were president, I would be appointing you in this role because Hopkins kicks ass when it comes to getting the word out on what's real, what's misinformation, and you do it in a smart, clever, and often really funny way. So thank you for being judge number 1. Much appreciated. Dr. Vanya Jones. Dr. Vanya Jones, Assistant Dean of Community Engaged Research. I call her the provocateur. She is the person who I always know will tell the truth, be a voice for the community, and gets things done. I was going to say a different word, but she's also the only person I know in here who has a beverage named after her. Michelle Spencer, there's another 5-10 minutes that could go on. You are I was going to call you the director. I do think of you. You are the heart of the Bloomberg American Health Initiative. I think we call the initiative. You are the initiator of the initiative. You just bring it energy, you bring it joy, and thank you for being one of our judges. Great perspective and talent. So without further ado, I'm going to introduce you to the real boss of the Lerner Center. And I want to thank also the extraordinary teamwork that's been going on with the Lerner Center team. Amber Ray
Just helping.
is just helping. You could be the boss too. But we have, I'll introduce and thank the whole Lerner team in a moment, but let me bring up Diane Caraggio, who is our chief of staff, really makes the train run, builds the tracks, does all kinds of things to make it happen. She's going to lead us through our finalists and make things happen smoothly from now on.
Don't overpromise. All right, thank you all for being here in person, and thank you to everybody who is joining us online. So I am going to introduce each of the participants and ask them to come up. We will have one presenter online. First, I'm excited to introduce Melissa Hopkins. Melissa Hopkins is an assistant scientist in the Department of Environmental Health and Engineering and the Health Security Policy Advisor at the Johns Hopkins Center for Health Security. Melissa will be presenting on a staff delegation on AI and bio risks. She'll quickly outline why Congress often has a hard time regulating emerging technology and how a staff delegation on AI and bio risks could result in legislation to improve health security. Welcome, Melissa Hopkins.
Okay, can you all hear me? Yes. Okay.
Great. So thank you so much to the judges for taking time out of your schedules to judge us all. Thank you for the other contestants for being here. And of course, thank you to the Lerner Center and the Bloomberg School of Public Health for hosting this great event. I'm Melissa Hopkins, and I'm assistant scientist at the Bloomberg School of Public Health in the Department of Engineering and Environmental Health and Engineering. I just started last February, and since then it's been really great. I'm also a health security policy advisor at the Center for Health Security, and what I'm going to be proposing today and pitching is a congressional staff delegation on AI biorisks. A congressional staff delegation is a 3 or 4 day event where staff go to a particular location, such as maybe Johns Hopkins, and they tour different facilities. They have speakers and events. They have lunches and dinners, and this is really the best way to get congressional staff up to date on very fast-moving issues. Oh, okay, I want to go back. So the issue is that since the 90s, Congress has depleted resources in terms of being able to appropriately govern technology issues. They used to have the Office of Technology Assessment in Congress, which is a thing like a Congressional Resource Service. That's gone. Resources that used to go to the office to have competitive salaries, to get technical expertise in Congress is gone. That's why they often rely on tech fellows now. And so for the past 2 years, before I came to the center back in February, I was a congressional staffer on the Hill, and I was dealing with the tech and telecom portfolio most recently for the chair of the Communications and Technology Subcommittee in Energy and Commerce in the House. So I know firsthand how much Congress needs to deal with these issues. And so the issue of AI and biotechnology is that AI can do an enormous amount of good. We can have AI that helps us in medicine, in engineering, in public health in general, in terms of surveillance. There's lots that AI can do that will be great. But in order to leverage the use of AI in healthcare and public health, we need to make sure that congressional staff, who are the people who are writing these bills often, understand the risks appropriately so that they don't over-govern or over-regulate these risks so that we won't be able to realize these potential benefits. So the opportunity is extremely ripe right now for dealing with this. There's been congressional hearings on the issue. The AI Safety Summit in the UK is happening today. It's day 2 of a 27-country AI Safety Summit, which Kamala Harris is attending on behalf of the United States. There's several different academic papers that are coming out on AI and biorisks. Chuck Schumer is creating an AI piece of legislation that will hopefully include biosecurity risks. I should also mention that at the AI Safety Summit, they've mentioned that biological issues are one of the issues that they're most concerned about. And then we have pieces of legislation coming out in Congress about AI and biosecurity risks. And then we also have a congressional Capitol Hill Steering Committee on Pandemic Preparedness that the Center for Health Security runs that will be having a AI and bio session in the next year. And I can talk more about that in the next slide. So I'm just going to point out here what we've done so far to lay the groundwork and why I think that we'll be successful in having an impact with the congressional staff delegation. It's the case that since I've been at the center, we've been involved with educating congressional staff on AI and Biosecurity Risk Assessment Act, a Securing Gene Synthesis Screening Act, and these are just several other key provisions and pieces of legislation that we've educated staff on since I came to the center. And the Capitol Hill Steering Committee on Pandemic Preparedness, we work closely with staffers in a bipartisan, bicameral matter. We have honorary co-chairs who are in both the Senate and the House and who are on both sides of the aisle, who we've been working with on these issues. So what we're doing here is really just building on what we've already been doing, because the congressional staff delegation isn't just a one-off meeting. It's 3 days for staffers to really get completely up to date on a really fast emerging technology. Also, I'm friends with the staffers, so that helps. I run a monthly biosecurity meetup in DC, and I also run a monthly Hill staffer meetup for effective governance. And so that can help. So the action plan for this is to pick a location, hopefully maybe Johns Hopkins. Staffers like to do a lot of interactive work when they're on a congressional staff delegation. So we have great resources here at Hopkins, like the Advanced Physics Laboratory. We have a biosafety lab. We also have the new AI X Foundry. So there's lots of opportunities for the students to tour different facilities and see what there is on the latest and greatest of AI, while talking to them about appropriate governance mechanisms. We'll also leverage opportunities for leverage and optimize for legislative opportunities by ensuring that the congressional staff who attend our meetings and their bosses are aligned on leveraging AI for good while appropriately mitigating risk, so that we don't get this wrong when we do have legislation down the line. The AI executive order recently came out. It came out on Monday, and there will be congressional action that's needed in the follow-up to that. And then follow-up. After the congressional staff delegation, there will be several follow-up with staffers that will help in making sure that the things that we teach them and our messages are being heard. And so the impact this is a workshop draft agenda from a congressional staff delegation that Stanford had, and that has resulted already in some great biosecurity work in Congress. And so the hope is that the same will happen for this congressional staff delegation as well. Thank you very much. I appreciate it.
Thank you, Melissa. That was wonderful. We're going to turn to the judges for some questions. If you could please use the mic so we can hear you.
Awesome presentation. So I'm going to ask a couple of questions in rapid fire. Feel free to answer. How robust were your monthly Hill meetups that you're currently doing? How long was the Stanford convening that you said led to a global kind of impact? And what do you believe the impact of this 3 to 4 day convening would mean? What's the overall impact do you think your particular initiative would have?
Yeah, so they're bipartisan, bicameral, usually between 10 to 30 staffers or people. What's the second one? Stanford, it was 3 days. The Institute for Progress also had one that was 4-day long one. And then the impact will likely be just the relationships that are forged and also the alignment of the staffers with the idea that you shouldn't overgovern AI so much in reacting to risks, but also that governing AI in an appropriate way so that Congress doesn't end up being reactive to the risks and then overregulate is like a great way to go in terms of realizing the benefit of AI.
So you just mentioned the networks between the people who are attending. You mentioned a couple of products. Can you tell us what would be your definition, A, of successful measures of this particular convening, and what would be some considerations for evaluation if it actually did what you think it should do?
Yeah. So there's 2 different ways that it can be successful in terms of impactful measures. I think the clearest way for me that it would be impactful is that I make a connection on the congressional staff delegation that I later leverage when we're educating staffers about a particular piece of legislation that they're considering. Because the relationships really in DC go a long way. And this is one of the best ways, not just to forge relationships, but also to really steep them in a particular way of thinking about an issue for 3 days, like not having anything on their plates, which is really hard in Congress because it's so fast moving, you have so many things going on. It's really hard to get dug in on an issue. And the hope is also that just even without me coming back and following up, they will have a new way of looking at things that come across their desk that hopefully orients towards good. Yeah. Thank you. Thank you very much.
Wonderful. Thank you, Melissa. It's not easy to go first, so really well done. Thank you. So next up, we have Cass Crifasi. She is at a conference right now where she is presenting on the work that she's going to be speaking about. Cass Crifasi is an associate professor in the Department of Health Policy and Management. Cass will be presenting on firearm purchaser licensing laws. Firearm purchaser licensing laws are an effective strategy to address multiple forms of gun violence. Washington and Delaware are primed to pass these laws in the next legislative session with the support of strategic advocacy efforts.
Thank you, everyone, for the opportunity to present to you today. Apologies I couldn't be there in person. As Diane said, I'm at the National Firearm Research Conference in Chicago. So over the last century, we've made immense progress in reducing the harm from motor vehicles. We've made roads safer, we've made them easier to navigate, we've developed safety technologies in cars, and we've made drivers safer through training and licensing requirements. And what this means is that despite traveling billions more vehicle miles, we've dramatically reduced deaths from car crashes. Now, you might be thinking to yourself, Cass, you're here to talk about guns. Why are you wasting your time talking about cars? Two reasons. First, how many of you saw a car today? Just reflect, or you can raise your hand. I can't see you, but you can reflect. Probably most, if not all of us. Most of us are exposed to cars in some way every day of our lives. Another question, how many of you saw a gun today? Probably very few of us. Despite that difference in exposure, guns were involved in nearly 4,000 more deaths last year than cars. Guns are the leading cause of death for children and teens in the US. The second reason is that there are strategies that we can learn from our success reducing motor vehicle deaths, and one in particular is licensing. As a result of ongoing epidemic levels of gun violence in the US, we have more attention focused on this issue than perhaps ever before. Policymakers across the country bear the burden of gun violence in their communities. Firearm purchaser licensing is one of the most effective solutions we have to reduce gun violence and save lives. These laws complement our existing background check system to create robust mechanisms of accountability among both prospective gun owners and sellers, so that those disqualified from firearm ownership cannot easily obtain a gun. This law requires an individual to apply for and obtain a license before purchasing a firearm, just like you would get a license before buying a car and driving it off the lot. The process typically includes applying to state or local police, getting fingerprinted, undergoing a background check that examines more records, and completing safety training and a waiting period. These additional components play a vital role in preventing people with a history of violence, individuals at risk of future interpersonal violence or suicide, and gun traffickers from obtaining firearms. Firearm purchaser licensing laws are associated with reductions in multiple forms of violence by disrupting underground gun markets and delaying impulsive acquisition of guns. In fact, our research has found that states with these laws have lower rates of homicide, including mass shootings, suicide, and shootings by police. Firearm purchaser licensing laws are also supported by nearly 3/4 of American adults, including nearly 2/3 of gun owners. Because of this research, firearm purchaser licensing laws are an attractive solution. In the run-up to the 2022 election, we participated in a successful state-based gun violence prevention advocacy effort in support of Oregon's ballot initiative 114. We translated our research on firearm purchaser licensing by producing talking points, fact sheets, and a video explainer. We also participated in a media tour to inform voters across the state. Now, We're poised to focus supporting the passage of firearm purchaser licensing laws in Washington and Delaware in the upcoming legislative session. We'll do this through developing research translation materials, building relationships with changemakers, and coordinating dissemination to get needed information into the hands of people who can use it. In addition to producing videos, speaking at webinars, and providing testimony in support of these bills, we've produced state-specific fact sheets for Washington and Delaware to support our efforts. Working in close collaboration with the Alliance for Gun Responsibility and the Delaware Coalition Against Gun Violence, both states are well poised to advance this life-saving policy. I'd use this award to support 3 advocacy actions. First, we continue to nurture and strengthen my existing relationships with state advocacy groups and policymakers by attending internal strategy meetings, participating in meetings with policymakers, and crafting op-eds and engaging in media interviews to generate additional attention for this policy. Second, we will generate and update fact sheets, infographics, and state-specific policy roadmaps. These will be disseminated through strategic communications, including webinars, forums, op-eds, and social media content highlighting research findings in support of proposed legislation. Third, I'll craft compelling written and oral testimony in support of these bills and participate in informational sessions. All 3 activities will support the passage of strong legislation and push back against changes that would weaken proposed or existing laws. A successful advocacy campaign for firearm purchaser licensing in Washington and Delaware would include educating policymakers and advocates about these laws, strengthening relationships with policymakers, state and local advocates, and the media, encouraging more stakeholders to testify, obtaining media coverage from briefings, and meeting policymakers and committee members for resource and information sharing. While the ultimate goal is to get these laws passed and signed, completing each of these steps will continue to lay the groundwork for passage of this life-saving policy in Washington, Delaware, and beyond. If you're interested in learning more about firearm purchaser licensing, you can scan this QR code. And I want to take a moment to acknowledge the amazing team of researchers and advocates at the Center for Gun Violence Solutions who are integral to our success. Thank you for your attention, and I'm happy to answer any questions.
Thank you, Cass, for the great presentation. This is Lamari, if you can hear me, see me, I don't know. So you mentioned that you're doing this work right now in Washington and Delaware. So these resources from this competition, how far will they get you towards success in those 2 states? And what happens next after that to get to all 50 states? I'm assuming that's the goal.
Yeah, thank you. Great question. So we have seen the success of dedicated resources in Oregon. So we have funding to do a little bit of work in a whole lot of states, but that spreads us pretty thin. So having these dedicated resources would help us be able to be on the ground in Washington and in Delaware. And if we are successful, and even as we're working for success in Washington and Delaware, California is actually getting ready to introduce firearm purchaser licensing legislation. So we're continuing to build off of our great work to get this policy in place in more states.
Hi, Cass. This is Vanya. I wonder, this is focused specifically on new gun purchases, and I wonder if you're thinking about the overall impact of the policy. How much do you think this would, in fact, impact, gun violence, given that there are existing guns that this wouldn't cover? Thanks.
That's a great question. We see firearm purchaser licensing as one part of a suite of strategies that we need to address gun violence. But what we do know from existing work, particularly on underground gun markets, is that requiring people to get a license before buying a gun, even these new guns, reduces guns available for use in crime. It reduces diversions of guns that could be used for homicide. And so we do see that in states that have firearm purchaser licensing, a very small proportion of the guns recovered in crime in that state started in that state. They're actually coming from other places. And so expanding this policy is going to give us less of a patchwork, hopefully, and more of a robust system across the country to reduce access to firearms by people who shouldn't have them.
Great, thank you, Cass. We're gonna stop there. Next up, we have Gigi Gronval. Gigi Gronval is an assistant professor in the Department of Environmental Health and Engineering. In their presentation on the critical need for the safety, security, and progress of virology research, Gigi will propose a proactive campaign to clarify how virology research should be governed and how to educate stakeholders on the importance of better governance, not only for future pandemic preparedness, but more broadly for the U.S. bioeconomy. Welcome, Gigi.
Thank you so much. Can you hear me okay? Great. Well, thank you very much for the opportunity to talk to you today. Let me advance it. Okay. So the core message that I have for you is that virology research is critically needed, but it's under attack. And what I am pitching to you today are all actions that I would like to take to preserve virology research so that we can continue to learn about viruses that cause disease so that we can defend against them. So the question is, why is it under attack and how? Well, a lot of this comes down to controversies over the COVID-19 pandemic origin. And there's actually quite a lot of scientific evidence at this point that demonstrates pretty well that, this is a natural spillover event that came into animals in Wuhan and caused a pandemic. But as you know, there are many people who believe that the COVID-19 pandemic started as a laboratory accident after researchers in Wuhan were doing risky, quote-unquote, gain-of-function research. And that belief has directly translated into introduced legislation in Florida and Wisconsin to ban gain-of-function research. And because gain-of-function is a very fuzzy term and the legislation is written so broadly, this could effectively stop, if enacted, stop virology research in these states. And this kind of this sentiment is spreading. There's another development as well. A biosecurity advisory board to the Department of Health and Human Services has introduced some proposed regulatory measures for virology research and other kinds of research that would introduce another level of review for work that is done. So you would already get scientific merit review for an NIH grant, you would get safety review, but this could be another federal level review that could potentially slow down research and cause a lot of uncertainty as they are trying to work out what is and is not allowed. So a lot of the problems here are that the rhetoric at the top it sounds good, right? It's that you want to stop dangerous things from happening. But translating that to the laboratory bench is really challenging. And so you have scientists who are trying to figure out what is allowed, what isn't allowed, what could get them into trouble. And research institutions definitely have an eye out for what is allowed and is not allowed and what could get the research institution into trouble. And in past experiences, we have seen that when this kind of thing is enacted, you have research that does not get done. That's important. For example, when SARS-CoV-1 was declared a select agent, University of Pennsylvania said, that's it, we're done, we're not doing any of this work anymore. And that was before the pandemic. Sure, it would have been nice to have some of that work going on. So virology needs advocates, and that's the role that I hope to play here. So this is a critical time for virology and a very challenging communication environment. So on the bottom left, you can see a scientific paper. I've written a few of these myself describing why it is important to look at the nuance of regulation and think about what the long-term consequences could be. But on the other hand, you have political officials who are using gain of function as a rallying cry. You have people who are organizations that are saying maybe we don't need to do any high containment research whatsoever. And then you have people who are comparing Tony Fauci to Pol Pot. So it's a really sticky place out there, but it's important to have voices in defense of virology saying, this is what brought us the life-saving vaccines that we all benefit from, and we need to have this, we need to continue to champion that. So what have I been doing about this? In addition to the scholarly work, I immediately after the Security Committee, Advisory Committee to HHS issued their proposed regulations, I convened a group of virologists around the country, biosafety experts, biosecurity experts, to respond to those proposed regulations. But there are two things that we want to do, not just to respond to this immediate threat, but what I'm pitching to you today, and that is, how should this work be governed? What is the right answer here? Because it's not enough to keep saying, no, that's not going to work for us. What is going to work? What is a good way that virology research can continue to make progress with safety and security in mind? And what the hope is that this proposal will end up becoming a large meeting that echoes what happened in the 1970s for what the Asilomar Conference that laid the rules of the road for recombinant DNA research and kicked off the biotechnology revolution. In addition, I'd like to expand media and political engagement on this. People need to know what's at stake and what the downstream costs are of inappropriate regulation. And I'd like to create some more partners on this. Vaccine developers have a lot at stake here, but they have not so far been talking about these issues. It's important for you to realize that even though virology research is critically important to the missions of funding agencies like NIH, NSF, and foundations, Gates, Rockefeller, et cetera, this is an unmet need. There is no one who has advocacy, this kind of advocacy in their portfolio. So without, it is, I think, a great opportunity for Hopkins to step into this role and create a system where we can have progress in virology as well as the safety and security that everybody wants. And then finally, just I want to make sure, because the research is not just a US thing, we want to make sure that all of the things that we come up with are exportable around the world, just like the Asilomar Conference was exportable around the world and really influenced the way that norms, biotechnology norms developed. And finally, just want to say that, sometimes people say, like, who are anti-gain of function, of course, virologists, maybe they don't want rules, but the fact is you need to have expertise there to be able to develop rules that are going to be durable, that are going to actually work, that are going to be understandable to the person who's designing an experiment, and maybe the person who's designing your next vaccine. So thank you so much for your attention.
Thank you so much. You started out by noting that you are working with a number of virologists locally or across the country. Who are some of the international partners that you would want to be working with and convening that you noted are important to this? And you also noted that there were some institutions who are no longer doing this research because of gain of function. And so are there organizations that you would want to be involved in this on the international scale who are saying they're not interested?
So I think there are definitely a lot of international researchers who, for example, the Erasmus Institute in the Netherlands, there's a lot of work going on in China. Ultimately, I would like to see something that works in all of these places because, virology research, it builds on each other, and it's a community that adds to the knowledge in this space. There is, of course, the example I was giving you was at University of Pennsylvania, where they decided to toss their strains, and I don't know if that happened here as well, but I just know that occurred. And I think you had another question, but I wasn't sure. Okay.
Hi, Gigi. Thank you so much. So I'm not a scientist, and I think most policymakers aren't either, maybe some. But could you just, in the simplest terms possible, explain what gain of function means?
Sure. So it's not any function. I think the functions that most people are concerned about are pathogenicity and transmissibility. And so can a virus become worse when it infects you, and can it be more contagious? The problem is those are really difficult qualities to measure in the laboratory, and they're very contextual depending on what animal system you're using, what kind of cell line you're using. So it's really hard to say, even though it's nice to say at the broader level, like, we don't want to make viruses worse. It's like, I'm working with mice here. It's just really hard to translate into a laboratory environment. And so it has to get more technical and boring in how you actually govern this work so that it's understandable for people who are doing this day in, day out.
Great, thank you, Gigi, that was wonderful. Up next is Nadia Akseer. Nadia Akseer is an assistant scientist in the Department of International Health. Nadia will be presenting on Mission Afghanistan 2030, a working group at the Bloomberg School of Public Health that has been advocating for protecting the health and health systems of Afghanistan. To secure a brighter future for the Afghan population, MA's 2030's advocacy will center around aligning key donors and engaging the de facto authorities on their gender policies. Welcome, Nadia.
Thank you. Okay. Thank you so much. Can you hear me okay? Yeah? Okay. Thanks so much for having me here. Friends and colleagues, I'm a child of war. I was born in 1985 in Afghanistan. My family fled Afghanistan to Canada in search of a better life. I studied in Canada my bachelor's, my master's, and my PhD. For my PhD, I studied maternal and child health and nutrition in Afghanistan. I spent 7 years studying the history and the health story of Afghanistan and all the progress the country had made for the past 20 years. In 2020, I joined Johns Hopkins University as faculty in the Department of International Health. My life has gone full circle, and today I'm here to speak to you about advocacy for Afghanistan. So let's get into it. What is the issue? The issue is massive, colleagues. In August 2021, Afghanistan's government fell apart, and the Taliban government immediately took over. What happened? The international community turned their back to Afghanistan, effectively taking away all the funding that they had been giving to them over the past 20 years for their health and for their development. So today, the United Nations calls Afghanistan the world's largest humanitarian crisis, with over 29 million people in need. Hunger and malnutrition are rampant. 50% of the population is experiencing hunger, 6 million people are experiencing severe hunger, and 4 million mothers are having severe or acute malnutrition. There are severe bans on women and girls' education. Afghanistan is the only country in the world today where girls' education is banned. They're not able to go to school beyond grade 6. Employment opportunities are not available for women. They're discouraged, in fact, not allowed to go work, and that is specifically because they don't want the coexistence of men and women in the workplace. And mobility for women is also restricted. They're not able to move around the country alone except with a male companion, which is extremely difficult to do. Health facilities, because of the lack of funding, are lacking the appropriate infrastructure. They don't have funding, they don't have staff, and they don't have equipment. So what is the opportunity? Friends and colleagues, today, Afghanistan is at a crossroads. They can either continue to move forward to achieving the health and health-related sustainable development goals if they continue to get support from the donors and the international community, or they will go backwards. They will go backwards, and they will go very, very quickly. So what can we do to help them? In my opinion, the best thing we can do to advance policy change is to do advocacy, and to do advocacy with two key groups. One is the donor community, and the other is the Afghan authorities. And I'm going to walk you through a journey of how I've tried to do this over the past couple years through this mission. So in September 2021, I started Mission Afghanistan 2030 for Afghanistan. The name comes from trying to do advocacy, research, and evaluation to protect health towards the end of the Sustainable Development Goals, which goes till the SDGs, which go till 2030. So what have we done in the past short few years? So I've been on a media rampage trying to talk to anybody and everybody I can about the situation. I'm raising awareness about this. So I was on the Muslim Network TV speaking about the crisis in Afghanistan. I worked with the Exemplars in Global Health Initiative. I was on Exemplar News to talk about how we can protect the gains that Afghanistan has made. I was doing a podcast with a consulting firm in Canada, talking to other academics about what can academics do? What can us researchers do to help protect the health of Afghanistan? I was on a podcast here at Hopkins on Public Health on Call to talk about the healthcare crisis in the country. I've been working with Kirk Humanitarian and Vitamin Angels since December 2021 on a program to deliver emergency nutrition commodities to women and children who are in need in the country, and that is ongoing. I wrote a panel, The Free Fall of Women and Children's Survival in Afghanistan, and submitted it to the Every Woman, Every Child Global Report, which they published in 2022. I also did 2 research projects on the livelihoods of displaced persons and migrants in Afghanistan, and also patterns and determinants of cross-border migration in Afghanistan with the Asia Foundation UK, and they published those in August 2022. Currently, I have a study that's ongoing that's trying to develop health research priorities for Afghanistan. So funding is suspended, especially for research. But if there are research priorities, what are they? This is the whole point of this exercise. And so this study has been ongoing from February 2022, and we've developed a priority list for the space of health systems, maternal and child health, and nutrition, and other areas. I'm also working on an Afghanistan SDG roadmap study, so I received a grant from the Countdown to 2030 consortium, and the study is ongoing as well. In May 2022, colleagues and I held a rally for Afghanistan in front of the White House and in front of the World Bank. We made all these signs and posters basically centered around the Sustainable Development Goals, sharing stats and figures and trying to raise awareness and lobby for the protection of Afghanistan's future. Here's the core team that worked with me on this. I wanted to share something that we prepared for that event. This is a piece of art that an Afghan diaspora has created, and I asked her to illustrate what is the situation in Afghanistan when it comes to SDG 2, zero hunger. And this was something that was happening in Afghanistan at that time in February 2022. Women were trading their kids in for food. There was no food, and they had no choice but trade in their kids. So in the painting, you can see mothers lined up as far as the eye can see, Afghan mothers with their child in the local market, ready to trade them in for food. And the mother at the front has just traded her daughter and received her food basket, but is walking away crying. And I think these types of visuals are so powerful to tell you and really just pull at your heartstrings and remind you, like, hey, there's real things happening in this country. At the global level, I really wanted to bring together key stakeholders to talk about, to have an open dialogue about what the situation in Afghanistan is and talk about what we can do moving forward. So we held a webinar series. Hopkins, multiple centers and institutes within Hopkins facilitated this or hosted this. It was a 4-part webinar series. The first session was on the healthcare system of Afghanistan. So we had key decision makers and donors from Afghanistan there, from the World Bank, from WHO. The second session was dedicated to maternal and child health. So you can see the folks there at WHO, the government, diaspora, the European Union was there. The third session was about the malnutrition situation in Afghanistan. We had UNICEF Afghanistan, academics, and others present. And the final session was about the Sustainable Development Goals and what can be done. And we had all the key donors, FCDO, USAID, World Bank, UNDP, MSH, and Ministry of Health present to have an open debate. So what is the action plan? Colleagues, if I get this award, I want to use the funding to first convene a virtual gathering to have donors come together and align around a plan or a strategy and funding for Afghanistan. And they're already starting to do this. So we think that we can take part in that. To hold a large awareness-raising cultural event and rally for Afghanistan, and then to formalize Mission Afghanistan 2030 into a center within the School of Public Health. I think that the impact we can have is that donors are aligned on their policies and plans for Afghanistan, major donors commit funding through 2030, and that we have Afghan authorities starting to open up to discussions about girls and women. And then finally, I just want to thank everybody involved, because without these folks, students, volunteers, faculty from within Hopkins and beyond, none of this would have been possible. Thank you so much.
Thank you, Nadia. Thank you, Nadia. That was really inspirational.
Hello.
Oh, we're gonna take a few questions first.
Nadia?
Sorry.
Don't run off just so yet, Nadia. Don't run off just so yet.
Sorry about that.
One of the things that we know from the work that I do here in Baltimore is that the political makers' turnover is a really big threat to the type of work that you want to do to sustain change in an environment. What are some of the things that you've built into the work that you're doing to help address that political leaders do and will and should change, and that might be a threat to the work you're doing?
Can you still hear me? So do you mean political leaders here or in the country?
Either way, I think both have real implications for your work.
Yeah, I think that is the biggest challenge that we're struggling with, because Afghanistan was doing okay and well up until 2021, and there was a political transition that happened, and because of that, everything started to fall apart. So that is a real threat and continues to be a threat. Now, one of the things that I want to do that I have been trying to do through my lobbying work is to speak to donors such as the World Bank, and others who are contributing to the trust fund to Afghanistan, to say, like, hey, we need a resilience mechanism. We need something in place here so that when the political transitions happen, and they will, and probably again, that there is a buffer, there is something for Afghans, there's some support there's some trust fund, there's some money, something that they can fall back on. And I think they're very much now opening up to that idea and recognizing how important it is, because frankly, a lot of the funding that came to Afghanistan over the past 20 years was from these same donors, and the country regressed when the political transition happened. So they don't want their investment, in a sense, to be lost either. So that thinking about resilience is definitely happening and something that I'm going to lobby for.
We'll take one more quick question.
Sure. Nadia, how would you measure impact?
Yeah, that's such a good question. I think I would measure impact for the 3 specific activities that I'm interested in. The first one, to bring donors together. I would measure impact if these donors first are willing to join this virtual convening. And then second, I think if we are able to have a good, productive conversation that results in a white paper or a policy brief or some other document that we can co-sign and publish, to me, that is one measure of impact. And then that goes, that can go beyond that. So I think that's one measure of impact. With regards to the cultural event, I think attendance, the number of people that we have join us from within and outside the Hopkins community, I think will be quite, eye-opening and help us measure impact. And then third, I would like to use some of the funding to open up kind of a center for Afghanistan here. And I think a measure of impact for me there would be whether we're successful at doing that. Thank you.
Thank you. Last but not least is Harry Barbie. Harry Barbie is an assistant professor in the Department of Health, Behavior, and Society. Harry's proposed advocacy work will support transgender people's access to gender-affirming care in 3 ways. Generate financial resources for transgender people seeking gender-affirming care, encourage state governments to adopt sanctuary policies that protect gender-affirming care patients, and establish a coalition of advocates who are dedicated to pursuing structural change that benefits transgender populations. Welcome, Harry Barbie.
Transgender people are under attack. This year, there have been 85 bills passed across state legislatures in the United States denying transgender people access to critical rights and resources. Compared to last year, we've seen a 320% increase in these policies, both being proposed and passed, suggesting that they're gaining momentum. The map you see here shows the states that have already banned transgender youth from accessing gender-affirming health care, a form of care that is evidence-based and allows transgender youth to align their physical and social presentations with their own gender identity. Despite the difficult environment in front of us, I see 3 key opportunities for social change. First, many of the trans youth who live in these states must now decide, are they going to travel to other states to access this critical care? This is expensive, and transgender youth and their families desperately need financial assistance now. Second, policymakers in other states have expressed interest in passing sanctuary policies. These are policies that would give resources and protections to transgender youth that live in states that have banned affirming care, access in the sanctuary states. It would also give them legal protections from their states of residence. And third, there are many academic and private and nonprofit organizations that are already doing work to advance health equity policy for transgender people. But much of this work occurs in isolation, opening up a critical opportunity to build advocacy coalitions. I have a strong history of public health advocacy for transgender populations. For instance, my research seeks to identify, understand, and improve health outcomes among transgender populations, and I've published my work in some of the top journals, including JAMA Pediatrics. I also have a record of health advocacy for trans populations in the classroom. I've taught hundreds of students about transgender health advocacy, including in classes like epidemiology of LGBTQ health here at Johns Hopkins. My experience with the media provides me with expertise to advance my advocacy. In addition to trainings that I've accomplished here at Johns Hopkins, I've collaborated with dozens of journalists on issues of trans health advocacy, including at outlets like the New York Times and the Washington Post. And finally, my history of building community partnerships has strengthened my capacity to engage in this community and to engage in this advocacy. This commitment to community engagement emerged while working at the LGBTQ+ Policy Lab, where I regularly worked with community organizations to translate research into public policy solutions. My action plan involves 3 major steps that will involve both short and long-term changes in support of transgender health advocacy. First, provide financial assistance to transgender youth and their families seeking access to gender-affirming health care. I will leverage my relationships with major organizations, major LGBTQ+ organizations already raising funds to support transgender youth seeking this kind of care. I will use the award money to engage in a media campaign that will increase the amount of funds available to trans youth and their families that live in states that ban gender-affirming health care. Second, create a communications campaign that will provide state and local policymakers with critical information that they can use to legislate sanctuary policies. There are many policymakers who are already interested in this, but lack the information needed to develop the policies and implement them. I will use the funds to engage in a communications campaign to get that information to policymakers. And third, build an advocacy coalition of key individuals across private industry, academic organizations, and nonprofit organizations to meet in Washington, D.C. to develop a long-term strategy in support of transgender health equity. Specifically, we will develop a long-term strategy to increase support for the Equality Act. This is a federal piece of legislation that would provide the most comprehensive anti-discrimination protections in history for transgender people across all domains of life, including healthcare. I will apply specific measures of success to each of these advocacy actions. The primary way I'll measure success for my first action step is by tracking the amount of money raised for transgender youth seeking access to affirming care, as well as the number of youth that benefit from these funds. Thus, success would involve increasing the amount of funds available to families of trans youth that live in states that ban gender-affirming health care. I will measure success for my second advocacy step by tracking how many policymakers explicitly endorse sanctuary policies for gender-affirming care. In this case, success would involve increasing support for sanctuary policies among legislators. I'll consider my third action step successful if I am able to assemble a group of key advocates across academia, nonprofit organizations, and private industry to assemble in Washington, D.C. to strategize long-term solutions for increasing support for the Equality Act. I've been advocating for trans populations for a long time, and frankly, the work often feels like pushing a boulder up a hill. But that is what we do as advocates. We push boulders up hills because often there is too much at stake to let the boulders slide back. I hope we can all agree that trans people deserve rights and human dignity. But in doing this work, I realized that joy is a critical element to stay engaged in this fight. I believe that trans people deserve joy, and especially transgender youth. The work I'm proposing today will ensure rights, dignity, and joy for transgender youth, and I hope you'll support me in achieving this goal. Thank you very much.
Hi, Harry. One of the things that you're hanging your hat on is the sanctuary cities sort of the laws or policies. Those would vary. Can you talk a little bit about your sort of measurement of a sanctuary sort of space that really would provide what you're looking for transgendered youth and joy and receiving access to care? Because they probably will be different from place to place, right?
That's correct. So currently we know that there is increasing momentum for these types of policies. In fact, there have already been 12 states that have passed these policies and several other cities. Now, these policies do vary across jurisdiction. Many of them involve health privacy protections and various forms of law enforcement such that transgender youth and their family cannot be extradited back to their states due to seeking this care. But there is also opportunities to expand telehealth such that transgender youth and their families don't have to travel, as well as increasing funds for trans youth to have these kinds of access. We know from much research that those who desire access to gender-affirming care have significantly higher improved levels of mental health outcomes. And so by increasing access through these policies, although it is although it does not get rid of the many barriers that they still encounter, it provides critical access that will protect their mental health in critical ways.
Thanks for that, Harry. I was going to ask how many states have these bans, but you just noted that there are 12 states. So I just 12 states
Sanctuary policies. There's 12 that have passed. Yeah.
Perfect. So are you working in any of those 12 states
that have passed the sanctuary
Yes.
policies? Well, I am indeed, because Maryland is one of them. Yeah.
Awesome. Awesome.
Sure. Thank you so much. I was hoping you could clarify, as a percentage of your work, how much is going towards kind of opposing or advocating against these legislation versus working around them when they exist? Like, what's the balance of that, especially maybe in your long-term vision?
That's a fantastic question. I'm moving forward with the assumption that the policymakers who are enacting bans on youth access are not interested in expanding access. And so my immediate goal is to create mechanisms for those who need access to get that access. And that's where the sanctuary policies come in. Now, at the same time, it is critical that we look at the fundamental issues, and that's where my efforts toward increasing support for the equality come in. This is a federal piece of legislation that would be the most comprehensive anti-discrimination policy in history for transgender people. And as I said before, it would apply to all aspects of life, including access to health care.
Harry, thank you, and thank you so much to our extraordinary finalists. Well, the judges are getting very excited right now because I'm going to speak for them for a moment. Wow. Yeah. Okay? Wow. Those were excellent presentations, and I think you make us all very proud. The work you're doing, the work you want to do, and your willingness to take extraordinary research and evidence and be out there on the front lines is something we all can't thank you enough. And I also want to thank everyone who had applied for this opportunity. We have a really healthy faculty that are up and coming. This is the future, and we are going to do more and more of this type of work, and thank you for being on the front lines, not just of doing this work, but showing how important it is in our school and abroad. So now this is the voting time. All right, now I told you to be connected to Wi-Fi. Get it, the QR on your code or on your phone. And if you're for some reason having a hard time with that QR code, the actual site is listed there. This is your opportunity to vote. Our judges are doing, they're madly calculating and doing their rankings, but you also are part of this calculus. So please make sure, this will be up for a moment. We're going to take a few minutes to give you time to get that, but I want to, while we're waiting for you to do your voting, we're going to have a little pop-in from our previous winners of the Advocacy Achievement Award, who are also in Chicago presenting on their findings and the work that they won. Let me hit. I got it. You got it.
Good evening. My name is Shannon Frateroli. I'm a professor in the Department of Health Policy and Management and a core faculty member of the Center for Gun Violence Solutions. I really wish that I could be there with you tonight. I remember fondly last year when Josh and I were the first recipients of the Sommer Klag Advocacy Achievement Award. It was such a special night and such a great honor to really celebrate advocacy in the school in this way. But we are in Chicago at the National Firearms Research Meeting, where we are presenting on extreme risk protection orders, which is the work that really led to the tremendous honor of being the inaugural recipients of this tremendous award from the school.
I'm Josh Horowitz. I'm the co-director of the Center for Gun Violence Solutions, and I had the great honor to share the award with Shannon last year. This award is based on the work that we've done over many years advocating for extreme risk protection order law. And I just want to give you a little update about what we've been able to do with that prize money that we got that year, which was fantastic. We've been able to really up our legal advocacy. And as anybody who follows advocacy, especially around guns, knows, there's been a lot of Second Amendment challenges to gun laws, especially domestic violence protection order laws. We're very interested in protection order laws. We want to make sure that we preserve those laws because they save lives. And with the prize award last year, we've been able to hire a new team member who focuses on protecting those laws from legal challenges and really advancing our legal advocacy. We've worked so hard to get them on the books, but now as we implement them, we need to protect them. And this prize has allowed us to directly help and protect those laws. So we are so thankful to be recipients and know that this year's recipients will do equally great things with this award.
We look forward to connecting with you when we're back in Baltimore, but in the meantime, please enjoy the reception and congratulations again.
So Shannon gave you a clue. There's really good food coming. And that will be downstairs at the Wonderwall. Keep voting. Wonderwall! If I want to call it Wonderwall, you can. Do you know what I'm talking about? Yeah, I believe in brevity. Thank you for being so focused and on time. Speaking of brevity, judges, thank you for all the work you're doing. I want to give an enormous shout out to the Lerner Center team, Diane, Amber Ray, Martha, Megan, Avian, and Chanel, who's guarding the food for you. Thank you for the tremendous amount of work that went on, not only finding faculty who were hungry to do this. This isn't about the food. Doing the early screening, taking care of our judges, putting this extraordinary event together. Thank you, and thank you to IT and everyone else. Thank you for voting online. I know that we have some record numbers that are coming in. I'm hoping that, we're seeing all those votes coming in, and I won't tell you who's doing the tabulating. She's looking a little nervous with all the numbers coming in, but we will make the announcements in wonderful public health Barbie style There will be envelopes and announcements down at the Wall of Wonder, also known as AKA Wonder Wall, because wonderful things have been happening here. Thank you again. Thank you for everyone participating, and we'll see you soon. Advocate hard, everybody.